Today I want to tell you about a case that has created a firestorm in psychiatry and palliative care, whereas palliative care is the subfield of medicine to help people die with dignity and with a good quality of life. As a background, you may know that a couple of years ago, Canada, the Supreme Court, almost overnight legalized a medical aid in dying called by the acronym MAID, M-A-I-D. There was some pushback about this because some mentally ill homeless people requested assisted in dying, and people thought, well, this is not what we want. We don't want people who, don't have homes and are mentally ill to be helped to die. This is like Kurt Vonnegut's Welcome to the Monkey House. That became an issue in Canada. The United States, several states have legalized physician-assisted dying. New York is about to do this. I think Illinois also. Usually people think you need a terminal diagnosis, only 6 months to live. People are thinking about cancer, coronary heart disease, AIDS, but not mental illness. So this case involved a woman. She was written up in the New York Times Magazine called Naomi. I'll post a link to it in the comments. I don't know if Facebook will let me show her picture because it's copyrighted. We'll do our best. It is about her struggle with anorexia and her request for medical assistance in dying. So I'm Gregory Pence. This is Great Stories in Bioethics, my personal YouTube channel where I'm only speaking for myself and no one else. This is the case for today.
Knock, knock, knocking on heaven's door. And knock, knock, knocking on heaven's door. Knock, knock, knocking on heaven's door.
A lot of people in psychiatry admit that anorexia is one of the most difficult things to successfully treat. It's often girls who are long-distance runners or ballerinas often develop a version of anorexia. Today, with the so-called thin culture, there's more anorexia than ever. This is an interesting case where food ethics and bioethics merge. Treating anorexia has very mixed results. One of the first and one of the most controversial cases in Holland was when they let a woman die with physician-assisted help who had lifelong anorexia. This is a very difficult thing to understand, where people would really rather die than eat a mouthful of chicken soup or a biscuit. So philosophically, one of the problems is that we don't want to make it a case like Elizabeth Bouvet, where a decision to die is itself indicates depression or irrationality, because that's kind of circular. Because the only way that Elizabeth could prove her rationality was by deciding to live. In the same way, in this case, Naomi has been anorexic since she was 11 years old. In this case, she started anorexia at 9. The case started by a psychiatrist who wrote it up in 2018. As far as I know, she's still alive 7 years later. She has been in and out of treatments forever. She purged so much. She wore off all the enamel in her teeth, and she had to spend $22,000 for a new set of dentures. She has been, parents supported her financially. She's been in and out of treatments many, many times. She says she hates her body. And the case began when there was a psychiatrist at Johns Hopkins who had treated, according to her, thousands of patients of anorexia, and did believe that some were just beyond help and would qualify for palliative care, which basically means keeping them comfortable as their own eating disorder kills them. Other psychiatrists pushed back and said this is basically abetting suicide by self-starvation, and we can't allow that. In Colorado, Naomi found a psychiatrist and a palliative care doctor who were much more sympathetic to her and agreed that they would no longer do something that is kind of barbaric that has been done to her in the past, and that is admit her involuntarily. And in Colorado, you can do this for 72 hours and force treat her. This is even more barbaric in states where you can permanently commit someone. I don't think Facebook will let me show some of the ways that people are involuntarily force-fed. Remember in the Elizabeth Boubet case, there were 4 big guys held her down and a feeding tube was forced down her throat. You can also implant a feeding tube surgically. There's lots of different, but it's, you are invading a person's body against their will. So one of the key issues here philosophically is whether there's such a thing as focal incompetence. In other words, some people would argue that because Naomi has this eating disorder for so long, it by itself shows this kind of psychosis, a severe depressive body dysmorphia disease, so she qualifies as a mental illness. But in other aspects of her life, she seems perfectly competent. She fixes dinner for her parents, doesn't eat any of it. She understands a lot of other things. She does not meet the standards of normal incompetence. It's tricky, but you have to commit somebody against their will so that they have a mental illness and are a danger to themselves. Is her lifelong anorexia a danger to herself? In an emergency, yes, she can be committed for 72 hours, but maybe not. There's been a lot of pushback in psychiatry about this. There was a conference about it in Toronto, I believe, another one in New Zealand or Australia. And psychiatrists are kind of divided. People in palliative care are divided. They argue there should be better drugs, there should be better care. Psychiatrists have tried every conceivable drug on Naomi, and just didn't work. She may also have bipolar disorder, severe depression, but she is fairly far gone. She can't stand to look at herself. She once poured bleach in her eyes, so she thought her quality of life would be higher if she was blind and couldn't see herself. In the hospital, she doesn't like to take a shower because there's a mirror there and she can see herself. She's disgusted by her own body. You might argue that one day maybe there'll be better drugs that will change the way she thinks, the way Prozac changed Tess's thinking. Peter Kramer wrote about listening to Prozac, but things don't look very good right now. There is some evidence that some people, after 20, 30 years of anorexia, do come out of it. And that makes things very complex. It could be that Naomi is one of those. The woman psychiatrist at Hopkins who has treated so many says it's impossible to predict who it is. And this is also a legal question because, legally she has a right to her life and her body, and she hasn't been declared completely incompetent. Of course, a lot of people fear a slippery slope here, that if you allow anorexia to count as a terminal mental illness, what about schizophrenia? That's biological. What about severe depression that's untreated? Can we let these people have medical-assisted dying? And what about insurance companies that might push, secretly or covertly, this to limit claims? So this is basically where we are. As far as I know, Naomi is still alive. You can see how this case has not only racked psychiatry and palliative care, but because so many young women are over-dieting and obsessed about their body image, the case also resonates much more widely in popular culture. I wrote up this case for Bioethics Bowl a year or two ago, and it was a very popular but difficult case. That's it for today. I hope you learned something. If you did, ring the bell, share it. We'll see you next time, next Tuesday at 4 p.m.
Knock, knock, knocking on heaven's door. And knock